I can say to my new Samsung Galaxy S25 Ultra, hey, find a keto-friendly restaurant nearby and text it to Beth and Steve. And it does, without me lifting a finger. So I can get in more squats anywhere I can. 1, 2, 3.
Will that be cash or credit?
Credit. 4.
Galaxy S25 Ultra, the AI companion that does the heavy lifting so you can do you. Get yours at Samsung.com. Compatible with select apps. Requires Google Gemini account. Results may vary based on input. Check responses for accuracy.
Today on CityCast Philly, Dr. Delana Wardlaw is a board-certified family medicine physician. Her identical twin sister, Dr. Elana McDonald, is a board-certified general pediatrician. These sisters recently launched a video podcast called The Twin Sister Docs. I caught up with the doctors in between patients to ask them about the show and the health resource they're providing to Philadelphians. We thought this would be a great conversation for Women's History Month. It's Thursday, March 27th. I'm Trenae Nuri, and here's what Philly's talking about. Are you all in between patients today?
Yes, we are.
Because you both are still practicing physicians here in Philadelphia.
Yes.
Dr. McDonald, where do you practice?
So I have 3 offices. I am sitting right now in my Memphis Street Pediatrics office, which is right at Tulip and Allegheny in the Port Richmond section. I also have Pazika Pediatrics, which is in Kensington and Front and Lehigh on Temple's Episcopal's campus. And then I also have Castro Pediatrics, which is in Oxford Circle at Castro and McGee.
Dr. Wardlaw, where do you practice?
So I practice in a community practice right at 4350 Germantown Avenue, 1 block down from the Wayne Junction train station. It's called Fairhill Community Associates.
How do you all have time to be full-time physicians, attend to your patients, and record a video podcast?
We ask ourselves that question all the time. But what I always say is, yes, we're very busy, but when we go back to the why, we figure out how to do it. Mm-hmm. We always figure out to carve the time into our schedules to make sure that we are getting this key information out to people who may not otherwise listen because they often feel unseen and unheard.
Dr. Wardlaw, tell me about some of the topics you all cover on the show.
So we cover a variety of things. One, we introduce who we are so that people understand Dr. McDonald's and our background and, why we are so committed to our mission of serving the community. 2, we want to help individuals to be able to navigate this sometimes complicated healthcare system. So be able to give them some tools in their toolbox so that they can be able to do that. Also being able to give them some information so they can become advocates in their healthcare. Sometimes you go to the doctor's office and it's not that you don't have a question, but you don't know what question to ask. Mm-hmm. And so just giving individuals basic information so that they can go to the office and be an active participant, because the doctor-physician-patient relationship is exactly that. It is a relationship. It does not work with just one person. It requires the patient to participate as well. And then we get into bread and butter topics, things that disproportionately affect marginalized communities. Unfortunately, the African-American community is disproportionately affected by many diseases, many forms of cancer, diabetes, complications of diabetes, kidney disease, HIV, to name a few. So really touching on topics that disproportionately affect our communities, and so that patients can have this information.
And not only just, topics that affects disproportionate communities, but these topics really can affect any community. Mm-hmm. So while we target underserved communities, this information is broad and anyone listening can use this information.
It could be used universally. And the other thing we also talk about is, difference between, urgent care and the emergency room, how to prepare for your doctor's office, making sure you know that what doctors you need to report to, knowing what your copay is, knowing what your medications are, knowing what your medical conditions are, and even knowing when you go to leave the office, what your next appointment is, so that you don't get into that hamster wheel of now not being able to get a follow-up appointment. Also, if you need to see a specialist, knowing why you need to see the specialist and if you need a referral. Because we don't make the rules if you need a referral. Your insurance company does that. And so people need to know what they can do on their part as well to make the doctor's visit a little bit more easier.
So Dr. Wardlaw, what you're saying is it's kind of like a resource for folks.
Yes. And really talking about some topics that come up every so often. We talk about the bread and butter, but then we also talk about, things that are occurring, facing our communities now. Right now, we're in a situation where measles has landed back on our doorsteps. And so we have to come back to vaccines and, how they are effective and how we can utilize those to best protect ourselves and our communities.
And I want to talk about that later. But in one of your recent episodes on the podcast, it was titled How to Find Credible Health Sources. And I immediately thought, okay, we're seeing public health data being scrubbed from federal websites following a directive from President Donald Trump in regards to, some rollback protections for transgender people. Doctors, how would you advise people to navigate public health information, especially during these times?
So the first thing I would do is, one, talk to your physician. And we say talk to your physician because your physician knows you. They know your active medical history. They know your past medical history, your medications, your allergies, your past surgeries, your family history. So they know everything that is pertinent to you to help you interpret information, because there's a lot of general information out there. To your point, we often we refer our patients to the CDC website, to the NIH website. As we say, these are all the alphabets that we refer to, all the letters. Dr. Wardlaw and I always refer to things as the alphabet. The National Institutes of Health, the NIH, the CDC, the Centers for Disease Control, the AAP, the American Academy of Pediatrics, which is our governing body as a pediatrician. And then Dr. Wardlaw's governing body is the American Academy of Family Physicians. So we use these entities to get vetted information that is based on data that comes from credible research. We are physicians, we are scientists, so we are going to direct you to the information that is accurate. Dr. Wardlaw and I come in because we want to make sure that people understand that information. So your physician is one of the best resources that you have to help you interpret the information that's out there. And as already mentioned, sometimes we're going to these websites and it's being taken down at the directive of this new administration. So patients are a little confused as to where they should go. So always start with your physician.
So you hear from patients, right, and families, misinformation across, various disciplines seems to be kind of challenging to navigate as doctors. You all mentioned also on the podcast that some patients come to you talking about misinformation. This was during the COVID-19 pandemic. Everyone's on social media and, information is being shared constantly. It could be accurate, could not be. So does that kind of make your head spin, and kind of walk me through, how do you have these kind of difficult conversations? Because sometimes people could be really committed to the information that they discovered, but it could not be the right information.
And so, Dr. McDonald, we always say, who is they? Who is they?
Oh, yeah, they say.
So patients will come to me and say, my grandmother said that I should put an onion in a bag to put under my pillow and that'll make my cough go away. And for that instance, I'll say, yes, you could do that, but the cough is going to go away on its own. It's a virus. So you can absolutely do that. But there are some people who are doing things like, people say my grandmother said that I need this antibiotic because I have the flu. Well, no, that's not the case. The flu does not respond to antibiotics. Viruses do not respond to antibiotics. So that is not the case. Or patients will come in and say, oh, well, I'm not going to get that flu shot because I don't want to get the flu. Well, that's something that we have to battle every single year with flu season. So these are things that just that land on our doorstep, and we just basically have to educate the patients. Now, some of them are true. You know what I mean? Grandma would say, drink that cranberry juice. That'll help with a urinary tract infection. Yes, that is true because the cranberry juice helps to acidify the urine and makes it difficult for the bacteria to thrive. So that is a wives' tale that we definitely still follow today. We still recommend today. Grandparents will say, hey, make sure you put that Vaseline on because it's cold outside and that'll prevent you from getting sick. Well, it's not going to prevent you from getting sick, but it will prevent your face from getting extremely, extremely cold, and it acts as a barrier or protection to your face so that you don't get, the
Windburn.
side effects from the cold weather.
More with the Twin Docs after the break.
Still getting around to that fix on your car? You got this. On eBay, you'll find millions of parts guaranteed to fit. Doesn't matter if it's a major engine repair or your first time swapping your windshield wipers. eBay has that part you need, ready to click perfectly into place for changes big and small. Loud or quiet, find all the parts you need at prices you'll love. Guaranteed to fit every time. But you already know that. eBay. Things, people, love. Eligible items only. Exclusions apply.
Hear that? It's SpringFest savings calling your name, only at Lowe's. Right now, get a free Select Ego 56-volt battery when you buy a Select Ego trimmer, blower, or mower. Plus, get your choice of any 2 bags of Miracle-Gro organic soil mix for only $16. Shop these can't-miss deals in-store or online today. Lowe's, we help, you save. Valid through 4/2. Selection varies by location. While supplies last. Excludes Hawaii.
All right, on this podcast, we've talked about how there's so many hospital systems here in the city, but many Philadelphians have a hard time of finding a primary care physician. What are some of those steps, or how would you all recommend Philadelphians find a primary care physician?
So there is one great resource that is out there now. There is the Black Doctors Directory that has pretty much all of the African-American physicians that work in the Philadelphia and surrounding area. So individuals can certainly start there to look for a physician, but also you can reach out to your insurance company to say, listen, this is my zip code. I am looking for a pediatrician in my area. But honestly, most of my new patients come by word of mouth, by referrals. Oh, when I meet a new patient, I always say, well, how did you find us? Oh, my cousin comes here. Oh, my friend brings her daughter here. Or someone in my child's class told me I was looking for a new doctor. They said I should give you a call. So a lot of times it's word of mouth, but some people just don't know where to start. So you can start with this Black Doctors Directory, and you also want to talk to your insurance company, and they can give you some guidance also.
I also want to talk about another scenario. I see a headline, case of bird flu, measles reported here in Philadelphia. Okay, those could be, public health threats. How should the general public evaluate those headlines?
They can always go to, when you hear these cases, you can always go to the City of Philadelphia's health department website. Mm-hmm. They will usually have the up-to-date, accurate information because they are the ones who's doing the surveillance, who's following the cases that's going on in the city. So the Philadelphia Health Department's website is one of the best places to go to see if what they're hearing is actually credible.
That, and aside from, again, contacting your doctor and see if these things are actually true and accurate, and debunking the myths. Dr. McDonald and I spend a lot of time debunking myths, trying to address misinformation. Again, with the, instances with the bird flu, people think, oh, if I go to my cousin's house, I can catch the bird flu. Well, you won't get it from an individual. There's not any human to human transmission. Is usually due to occupational exposure, people who are working with different animals or different flocks and things of that nature. So just making sure that people are aware of the accurate information, can tap into that accurate information. And I'm going to let Dr. McDonald discuss more about the measles vaccine, because she sees her patient population is much younger than mine. And so she sees that on a much more frequent basis than I do with the vaccinations.
Yes, so absolutely, we've seen measles epidemics, measles outbreaks, not epidemic, measles outbreaks, quite frequently in the last couple of years. We're currently dealing with the measles outbreak in Texas. We recently had an outbreak in Philadelphia in late 2023, early 2024. And again, measles is a standard vaccine that I, as a general pediatrician, and every pediatrician will recommend because that is the standard of care. And we know that measles is extremely effective, as Dr. Wardlaw already said, with preventing the spread, but also preventing the complications of measles. And the issue with measles, as which we see with a lot of highly contagious viruses or bacteria, is that by the time we figure out exactly what we're dealing with, so many people have been exposed at that point. So when you're dealing with conditions and viruses like that, the best offense is having a defense. We want to be a preventive mode. So we want to make sure that everyone has their vaccine. We want to be proactive, not reactive. Because, so say, cases of measles show up, again, it's 97% effective if you've had 2 of your vaccines. If you haven't been vaccinated, if there's 10 people in a room and a person walks in with measles, 9 out of 10 of those people will likely catch the measles. That's how highly contagious it is. So when we're dealing with viruses like this, we know how it presents. We know what the outcome will be. We want to prevent it from happening. And that's why the vaccine, which is safe and effective, is very, very, very important.
Outside of the bird flu, the measles, what other top health issues do you all see from patients here in Philadelphia?
We see commonly flu. So people tend to forget about flu. That flu can have, significant complications, particularly for those who are very young, those who are very old, who have other medical conditions. And again, we have a flu vaccine that is safe and effective, and it does not give you the flu, and making sure that we address that every flu season, and we're still in flu season now as we speak. Also, COVID is a year-round virus, and we know that now, 5 years into this, COVID is not going away, and recognizing that the best way to protect yourself is to be vaccinated, because again, we're seeing now the long-term complications of COVID, long COVID, where people have these chronic illnesses that have developed as a result of exposure to COVID, whether it's conditions with their lungs, whether it's conditions with their heart, whether it's condition with their cognition. You hear about the brain fog. So these are things that we are really seeing the long-term effects now, so that making sure that people are aware of that. Also, making sure that people are aware of pneumonia is out there. There are things, making sure you're protecting yourself against pneumonia. That's we very commonly see that as well. But other things that we see every single day, I see in my practice: diabetes, high blood pressure, heart disease, kidney disease, HIV.
Things that I see in my practice as a pediatrician: asthma, obesity, ADHD. Now we're in RSV season, right? So we see those things, and the flu. But common things that we see all the time is the asthma and the obesity. We're seeing a lot of children dealing with mental health issues. So there's a lot that we want to cover. Again, we try to go into preventive mode with a lot of things, but some things, as children are diagnosed with it, we want to make sure that, one, the parents understand what they have, how to treat it, how often they should follow up, so that we can have the best control of whatever disease process they have.
So your episode that just aired is about what we eat. Why is that important to talk about on the podcast?
The 3 best ways to stay healthy: nutrition, physical activity, and sleep. So nutrition is one of the main stays of being healthy. So the purpose of that podcast is to make sure that we are just talking about healthy nutrition. People have to understand, the impact that, one, understanding the 5 fruit groups, making sure that people are getting their fruits and their vegetables and their protein and their carbohydrates and their calcium, but also making sure that getting lots of water in their diet. And don't like to talk in terms of diets, because diets gives the indication that it's going to come to an end. We talk about healthy lifestyles where you are making small changes that leads to big outcomes or large outcomes. So nutrition is huge. We talk about portion control. We always talk about, we want you to eat, but you want to be mindful of what you eat, how much you eat, and when you eat. All of those things are hugely important in making sure that people are understanding the impact of eating foods that are high in fat, high in sugar, high in sodium can have on their body.
Yeah, because you are what you eat. And we know that obesity is an epidemic in this country, not only amongst adults, but also amongst children. We know that obesity can lead to many medical conditions, high blood pressure, diabetes, heart disease, which is the number one killer in the United States for males and females. And so having control of your diet, having control of what you are eating on a regular basis can very well affect the conditions that can contribute to you being at risk for heart disease, blood pressure, diabetes, high cholesterol. So these are things that we need to be abreast on, that everyone needs to be abreast on, so that they can be in control of what they are eating, and so that it can have a positive impact on our lifestyles and on our health conditions.
Thank you for these reminders and this information. How is it, or how has it been working with your sister on this creative project?
Oh, that's easy. We've although we've never officially worked together as we graduated from residency, we've done everything our whole entire lives together.
Mm-hmm.
You know, we've always been each other's best friends. We've always said, come into our sandbox and join us. If you don't want to join us, then you could go on your way. We went to all the same schools. We went through elementary, high school, college, and medical school together. So this was just a natural progression outside of our day jobs to come together and work together and focus on what we love, which is healthcare advocacy.
I echo what Dr. McDonald said. It's always been a natural progression for us. And people always ask us on many occasions, when are you going to do something together? When are you going to do something together? And so here we are. We brainstormed and we put our minds together, and Twin Sister Docs was birthed.
You were raised in Strawberry Mansion. You went to Central High School. Did you both go to Temple University and Penn State Medical School together?
Yes. We went to the Central High School, the 251st class, and then we went to Temple, where we were biology majors. So we're Temple Owls, and then we went to medical school at Penn State Medical School in Hershey. So we're also Nittany Lions.
Mm-hmm.
And then after medical school, that's when we started to part ways. I did my pediatric training at the great St. Christopher's Hospital for Children here in Philadelphia. And Dr. Wardlaw, where'd you train at?
So I did my training at the former Montgomery Hospital, which no longer stands. It is now Einstein Montgomery Hospital up in Norristown. And so it's been, working with my sister. She's your best friend, your biggest critic, and your biggest critic, because you always need someone to be able to give you that constructive criticism. And she's always the first person to give you that and we do it to each other. And it's always best, you have somebody who is in your profession. You call up and run a case by her, ask a question, and that could be at 12 o'clock in the afternoon or 2 o'clock in the morning.
Well, Dr. Wardlaw and Dr. McDonald, thank you both so much for joining me on CityCast Philly.
Thank you for having us.
Thank you for having us, yes. And make sure you join us on the Twin Sister Docs podcast.
That's all for today here on CityCast Philly. If you enjoyed this episode, share with a friend, rate the show, leave us a review, and hit that subscribe button. Be sure to sign up for our morning newsletter, Hey Philly, to learn more about what else Philly's talking about. We'll be back tomorrow morning with the Friday News Roundup. Bye.